Fluoride is an effective tool. It's one effective tool that can reduce the risk of tooth decay. It can, depending on the study you look at, it can reduce tooth decay anywhere from 20 to 40% about. It is most effective topically rather than systemically. So the most effective fluoride is fluoride that your teeth are physically exposed to. It is not very effective just by ingesting it and it being in your system. So that's where my colleagues and I agree. There have been more and more studies more recently that are showing that maybe it's not as safe as we once thought it was. And that's where we start to differ, because the studies that are coming out, yes, they are new, but they are compelling stories. And I was taught that, first do no harm and informed consent and, medical freedom. People should have, agency to choose their medications and treatments and so forth. And there are several things that are happening when the government entity, and it's not, some big vast conspiracy. I don't think this is, dentists have said that fluoride is good. So therefore local governments add it to the water when it's convenient and cheap to do as a way to help treat cavities. And dentists, the CDC, all these government bodies have said that this is a good thing. In my mind, I have ethical issues with that because it is added in order to treat and prevent cavities, to which no one has consented to. So it is a medical treatment without consent.
Interesting. Yes, yes, yes.
When it's in the water supply, we actually can't control the dose.
Mm.
So a 70-year-old man who drinks 1 glass of water a day when he's thirsty, the dose that he is getting is vastly different than the dose an infant is getting who is drinking primarily formula mixed with tap water. Vastly different doses. And we can't control it. Because when it's in the water supply, it's actually everywhere. So every manufactured food, any food or drink, if it's in a bottle, a can,
Yeah.
a box, anything made with a municipal water source that's fluoridated is going to have fluoride in it. And we can't control that.
Yeah.
So when we can't control the dose, it is a medication without our consent, even though, they would argue that it's naturally occurring. Well, it's not naturally occurring in the way that it's given to us. So I have real ethical issues with it. And you combine that with the fact that according to more recent research, we actually don't know the dose that's safe for everyone. So if we don't know how much is safe and how much is going to start causing issues for people, then in my mind, we should not be using it until we really can know and be sure.